Hi there guys, so last video now, part 5 of 5. This one's going to be on treating Tietze syndrome. So there's 3 main reasons, or rather main treatment methods that I know of which to improve Tietze's. The first one, really obvious, you're probably not going to want to hear it because if you're like me you don't like sitting still, but it's rest. So you need some good old-fashioned R&R. Tietze's is going to be aggravated by any kind of activity you do, whether it's heavy lifting, putting any sort of stress on the chest. So racket sports, athletics, that's all out, which coincidentally is something I do a lot of. So naturally I didn't rest and still perform those things with the injury, and lo and behold I still have it. So whether that contributes to it or not, I don't know. But I definitely wouldn't advise doing that if I were you. So rest up, that's the main thing here. NSAID pain relievers. I think I have some here. Hang on. Yeah. So I have some 50mg diclofenac sodium for you. This is what it looks like that. Okay. 1 a day for this one. That usually clears it up, takes the pain away, but most days if you're having a bad day it'll take the edge off, and that's pretty much it. So get used to that. Don't take them too often would be my advice, because again, just from my own experience, I took them when I was 20 for a period of about 3 months, and I was taking them every single day, just because with the amount of work and stress I was under, I couldn't function without one. It came to the point where I reached a threshold level and I didn't want anything stronger to be prescribed to me, so in the end I went cold turkey off them without any pain relief for about a month after that, to let my levels in my body, if you like, to return to an under threshold level, or to return to normal. So if you take them intermittently, only when you're in pain, then you'll be fine and you won't have this sort of problem. As well as diclofenac, you're going to probably take things like aspirin, ibuprofen, naproxen I believe is another one. But just be aware, obviously, that as these are, in their defined term, non-steroidal anti-inflammatory drugs, you should not be taking them, and I stress, you really should not be taking them if you have asthma, if you have high blood pressure, or if you have kidney or heart problems. So absolute no-no, because they won't do those conditions any good whatsoever, so you really don't want that. Also, if you are under the age of 16, I believe you're not legally allowed to take aspirin because of the development of your body at that stage, but just check with a GP, obviously, before you take some aspirin out of the cupboard at home. Just make sure you check. Apart from the rest and the NSAIDs, the only other one I know of at the moment are corticosteroids. Now these are injections that can be used to treat it, and they go straight into the costochondral joint. You're given a local anaesthetic beforehand to numb the area where the injection is going to be taking place, and this helps to reduce the pain and the swelling in that area. However, this treatment is only usually offered once or twice to patients in the same area, because it can cause damage. And at any one time, any injection like that carries about a 10% risk of puncturing a lung. So not the best option really, considering it's got limited amounts of uses, only once or twice into the same joint. 10% isn't a big risk, but you don't really need that when you're going into it, and the stress of the procedure alone is probably going to aggravate your condition while you're in there. So it's really, if it's something you can do without, then please try and do without it. Only consider it a last resort. Otherwise, the NSAIDs are probably the best bet. you need to rest up as soon as you have a diagnosis, or as soon as you're experiencing the symptoms and the pain. You need to rest as much as possible for the next 12 weeks. Obviously go about your day-to-day business, but just try and not, it's just for 12 weeks, just don't do anything that involves too much movement in the chest, too much lifting. Just be sensible about it, because you can either have it for 12 weeks or you can have it for an indefinable amount of time. So far I'm hitting 2 years now. In the last few days I've hit 2 years of this, and it's really starting to I'm just getting a little bit bored of the pain by now. So just take care of yourselves, guys, and I hope you found these videos somewhat informative. And if you want to know more, then just post me a question or send me a message, and I might make a video on it. If there's anything you want to know in particular, then ask me to make a video on it, and I'll do some research for you and find it out. Apart from that, that's all I got so far on this, and I hope you guys stay well and stay healthy. I'll see you soon. Bye.